Hi, Dr. Patterson here again. And in this video, I'm going to talk about artificial intelligence and its influence on healthcare, education, and childcare, which are staggering. It's nothing new, as its development can be traced back to about the early or mid 1950s, about 1956 to be precise. There's nothing to be afraid of, as the um artificial intelligence engine learns from us by modeling and capturing the information or data from everything we put online. So if there is bias or anything that we can see in our society, we know that about 62% of the people in this country are biased about something, and so it's going to capture that. So when its influence in certain areas is going to have to be dealt with in such a way that we won't pick up the bias. But what happens is that the data doubles every 24 months, and the data that's doubling is that we're looking at 99% improvement. There are a lot of dollars that are invested in this now. The AI can model the thing that I'm looking at in terms of healthcare. We know that it's going to also influence those who will invest in it for nefarious reasons. But let's look at it from a healthcare perspective. And in terms of the nervous system, AI can model neuronal systems. And it can do this with no on or off switch, meaning that it's going to do this at super light speed. And this is important in people suffering with paralysis as a result of a stroke or severe stiffening disease, like what you've seen with the singer Celine Dion. But what happens is that what we're looking at is the speed at which it operates, and it allows this AI to exceed human capacity. So it seems like it's something that's supernatural, but it really isn't. It's just that it's designed so it can capture the information and the data at super light speed compared to what the human being can do. Now, the impact is going to be far greater than what we saw with the discovery of electricity and fire. Now, regarding health, it's providing information on aging for those who are looking for immortality, which that'll never be achieved, but we can certainly extend the life of an individual. Right now, we've noticed since COVID, the lifespan in this country have dropped by 2 years. But it must be realized, as I've stated before, like with anything else, is going to be used for bad activity or for nefarious reasons, as well as for the good. So we're looking at the good. If used correctly, the way I see it, AI should provide massive contentment for everybody. See, that's basically the way things are going with it. If you look at it from that perspective, things should be better. Now, I'm focusing on the benefits it's currently providing in a baroque, antiquated healthcare system, which is what I participate in right now. You know, the healthcare system is about 50 years behind. You have, when you're looking at the body, any practitioner knows this. Every practitioner can testify this. We have about 40 trillion cells in the body. Each one is involved in about a billion reactions per second. That's fast. We don't realize that. One of the best features of the human body is its ability to mask disease. So that's a good thing, but then it can be a bad thing. So, you know, when you look at it in a good sense for masking disease, we can take Parkinson's disease. You know, until you don't really develop Parkinson's disease until 70% of the substantia nigra. That's a part of that brainstem, which is very dark. And you go through that section, you see this here. It's responsible for movement or motor movement. Until 70% of that is gone, you don't really experience Parkinson's disease, but it's there. It's been there for years. 7% of all heart attacks have no warning. You know, it's no shortness of breath, no pain. There's no CT scan indicators. You know, in most of your cancers, the cancers that kill us, you're looking at cancers that have been there for a long period of time. They're not even screened for it. But we do screen for breast, prostate, colon, lung, and skin cancer. But you don't. We're not being screened for glioblastoma or pancreatic cancers. These are the ones that are, when they're found, it's like you only have 30 to 60 or maybe 90 days to live. When you develop cancer, you don't feel anything until about stage 3. And stage 1, stage 2, there's no indication that you have the cancer. So that's why it can be a lot of these cancers are very stealthy because it doesn't really let you know. But your body is actually working to prevent you from succumbing to it. So until it gets to stage 3, you really don't feel anything. And that's when it gets your attention. Then that's when you go to the doctor. But see, with AI, all that's changed. With AI, you'll know exactly what's going on inside the body in advance of any symptoms, in advance of any disease or its inception. So you'll be able to take action, see, just by going through the workup. Now, currently, there's the use of full body digitized MRI. That includes a brain vasculature that it's testing for. You have AI coronary CT scans, DEXA scans, and a full genome and full microbiome testing, blood work. And what happens with this, you get that rapid integration of all the data and the biomarkers through AI, which no doctor or group of doctors can do in a timely manner to let you know what's going on. Now, the only skepticism that I have is the full genome. And I can kind of go back to the phenomenon with Henrietta Lacks, where they discovered the immortalized cells. And but this was without her knowledge, and this should not be confused with stem cells. So the immortal cells with Henrietta Lacks are not stem cells. So, but these cells that was discovered with her condition, and she didn't even know that she had, from what I understand, when I read it, she didn't even know that she had cancer. It paved the way for research in cellular immortality. So that's what we're looking at. The question that I have, and the thing that I really have some sort of question about, and it's going to come up with Black people in this country because of the history of the CDC, the experiments that were done without the knowledge of the individuals being experimented on. We talk about the Tuskegee experiments. We have a gynecologist who, what they call the father of gynecology, he experimented and tested Black women, doing surgery on them without any anesthesia. So the skepticism is certainly warranted. That's the only thing that I have questions about now. So, and another thing about full that genome study, studying your DNA, is that right now, in order for a patient to get records about their medical history or their medical information from a doctor, there has to be, they have to sign an authorization for release of records. If this is not done, they cannot ascertain that information, whoever's looking for it. However, once this becomes something that's digitized and online, your insurance companies, we can't say that that information will not be shared amongst insurance companies, will not be shared with jobs. So your information about your DNA is out there. We don't know who's going to get it. So that's the only skepticism or drawback that I have with that. But when we going back to how it can affect healthcare, when we talk about cancers and aneurysms, the people who were tested, so this is currently going on right now. They have clinics that use artificial intelligence to test. We talk about cancers and aneurysms are found in 2% of the people who thought that they were in excellent health. See, now this is really something, because it's a person who took good care of themselves. They thought they were in excellent health, but come to find out, they had cancers, or they had aneurysm brewing, and it wasn't until they had the testing through artificial intelligence that this was found. Then when we look at life-saving findings, it's found that like 14.4% had some sort of condition, where AI was able to pick this up. Currently, it's expensive, but it's going to become affordable with stay-at-home therapy. See, and so they're sort of gearing you up for that. You're wearing wearables like the Apple Watch, the CGM glucose monitors, implantables, measuring data constantly. And this is going to feed back into your artificial intelligence centers, wherever that may be. It's going to check, and it's going to give indications in terms of your appointments, when you should come in, when and how you should modify your foods or your dietary habits, certain medications, herbs, all of that is going to be provided with artificial intelligence. So I look forward to that, and how patients can actually get better. And a lot of it's going to be done without you having to visit certain facilities, because through telemedicine, the doctor can come directly in front of you, to your computer or your phone. Now, the only thing in terms of a practitioner, when we look at AI in the future, as is related to the future of medicine, it's going to be considered to be malpractice to diagnose and treat a patient without it. You're going to have it. And the reason why I'm saying that is because I'm looking at the amount of literature and the speed at which all this information is ascertained per day by artificial intelligence. There are about 5,000 published medical journals every day. This is amazing. I typically have to read more than one for information, something I'm looking for as it relates to patient care. What's going to happen is AI is going to simplify this so accurately. It's going to simplify this in seconds, give me the information I'm looking for in seconds. It's going to also affect religion, like the Amish. These are people who, with their religious belief, they don't use technology. And I think Jewish people who, on the Sabbath, they don't use electricity. So it's definitely going to affect certain lifestyles. It's going to affect certain religions, the way we live. But in terms of the betterment of one's health, there are more things that are involved. Just really scratching the surface here, the tip of the iceberg. But there are many things involved that we can utilize this. So there's still a lot of kinks to be worked out. But when you look at things, it's going to really change a lot of our thought patterns. It's going to move us out of that thought pattern of Darwinism. It's going to move us into humanism. That's important because there's a lot of misinformation about that, and it was a theory, but a lot of factual information was thwarted as a result of that theory. So there's a lot more good in healthcare utilizing AI than bad, in terms of extending life disease-free. And so many of us are looking at it in terms of the loss of jobs. It's going to create a lot of jobs. You just got to change the education and move into an area where you can most benefit and still be employed or still be effective and have a way of living or making a living utilizing AI. The areas that is not going to affect in a negative way in terms of people losing their jobs is going to actually enhance. It's going to be in healthcare. It's going to be in childcare and education. It's going to enhance those areas. So I'm looking for something more positive to take place in these three areas, and it's definitely going to improve the quality of life if you're able to take advantage of it. Okay, so I'll be giving more information about this as we go along in future videos. I look forward to sharing this information with you, and hopefully you can start making some changes right now. When we look at preventive medicine, it's going to change the way prevention is being done today. I'm still holding on to the ancient way that healthcare was done, and the lifestyle in certain cultures, especially with Black people, not only in the United States but around the world. You were here first, and so basically our ancestors learned how to live in the environment that we were in. What were the better areas to live in, adapt to the foods. And so now when you're out of the area that your genetics and genome says that you came from, you have to go through a certain level of adaptation, and that adaptation might be detrimental to your health. It may shorten your lifespan. And so that's what we're seeing right now. But we'll talk about that in future videos. I just wanted to get this information out. I don't want you to be afraid of artificial intelligence. I want you to utilize that to improve your health and extend your life. Okay, until the next video, best in health.